Good afternoon, and welcome to the Flint Community Webinar Coronavirus. This is week 80 for us, September 24th, 2021. And we'd like to thank you for joining us for this webinar today, sponsored by the Healthy Flint Research Coordinating Center, also by the Flint Center for Health Equity Solutions and the Michigan Prevention Research Center. As we shared with you over these last 80 weeks, the Healthy Flint Research Coordinating Center is a community academic partnership, and our goal with this webinar was to bring to you relevant and credible information about this global pandemic with a really important local perspective. What could we do in the midst of this pandemic to ensure that our local community was aware of how to interact in these changing times? I'm excited to be your moderator today, Yvonne Lewis, as a co-director of the Community Core of the Healthy Flint Research Coordinating Center. I'd like to remind you, for those of you that are joining us, you may be joining us by Facebook today, please feel free to share it with others so that they have time to join us today. We have some great information for you today. If you have questions, please give us a call at 810-235-8130 or send us a question at info@hfrcc.org. We have been fortunate every week to have partners join us. Over 40 partners throughout these 80 weeks have joined us to provide information for you. And we're excited to say that many of them are join us every week to be available to answer any questions that you might have on the topics that arise through this session. So we'd like to appreciate those that are on our call today, on our webinar today, provide information for you. So please send those questions in, put them in the Q&A if you joined us in the webinar. Today, we've got, as I mentioned, we have a very exciting webinar for you today. We're going to be talking about insurance coverage. A lot of things have been happening with respect to additional testing needed. So we're going to talk to you a little bit about that. We have a representative from Dr. Yvonne Sissy, who's the medical director of the Health Alliance Flint. We're also going to bring back some information we've talked to you about before, COVID quarantine and isolation guidelines. Many are still asking about those questions, especially in this new environment where testing is available and the exposure is increasing. We'll talk about FDA booster guidelines, and on a regular basis, we bring to you updates from the Genesee County Health Department, our governor's office, and the city of Flint. So today we want to start right off with talking with Gary Jones from the governor's office. Gary, we appreciate you every week that you're able to come and join us and give us the updates. A lot's happened at the state level. Please give us the most relevant insights in these next few minutes that you have, because we know you have to go to another meeting, but help us to know what's going on out of the governor's office.
All right, yes, thank you, Yvonne. Yes, it has been a really, really big week. So try to be brief here. The governor recently issued a statement after the legislature passed a bipartisan budget that puts Michiganders first and makes game-changing investments in families, communities, and small businesses. The budget delivers on the kitchen table economic issues that matter most to Michiganders. It expands lower no-cost childcare to 105,000 more kids, helping thousands of working parents to go back to work knowing that their kids are safe and cared for. It increases rates for childcare providers and boosts slots available for infants and toddlers, ensuring more Michiganders have the early supports they need to succeed. It also delivers a one-time $1,000 bonus to childcare staff who served on the front lines during the pandemic and kept our economy going. It also provides a permanent $2 per hour raise for direct care workers who take care of our most vulnerable in nursing homes and beyond. In addition, it creates a pilot program to bring down utility bills for families by improving home weatherization and energy efficiency. It also provides alternatives to nursing home care for 1,000 more seniors, allowing them to stay in their homes, covers the cost of treatment for sickle cell disease for all Michiganders, helping those struck by this inherited disease get the care they deserve, invest in new, innovative mental health services to help those who need it most, hires healthcare navigators to tackle racial health disparities and increase coverage, grows the Healthy Moms, Healthy Babies in-home visitation program for infants born with substance exposure. And we also put $500 million into Michigan's Rainy Day Fund, which is the largest one-time deposit in state history. Those dollars help ensure that Michigan is prepared for any future health or economic crises. As always, we will be conducting a thorough legal review of the legislation to ensure that all provisions in the budget are constitutional to take action to fix the pieces that aren't. Now, with the budget out of the way, we can further collaborate to invest the billions in federal dollars we have received from the American Rescue Plan and the billions more we are expected to receive from the bipartisan infrastructure bill. And lastly, Secretary of State Jocelyn Benson yesterday announced that she is launching a mobile office next month to serve Michiganders with limited access to Secretary of State offices and the internet, including senior citizens, homeless shelters, foster care facilities, and other community organizations. The new Secretary of State mobile office will travel to and operate out of the lobbies and gathering places of partner organizations to offer the vast majority of Secretary of State services. And of course, as always, michigan.gov/COVID vaccine, as well as michigan.gov/coronavirus, still the best catch-all websites to keep updated.
Thank you so much, Gary. And that information has gone up. I just want to also acknowledge, Gary, that you every week stay in touch with the key leaders in the community so that they have an opportunity to have voice. Can you talk to us a little bit about how you take that voice directly from Flint back to the governor's office?
Yeah, absolutely. And so every day is to your point, Yvonne. That's what I do. So it's really twofold as far as like the work that I do. So it's one, of course, giving these kind of updates. I do several calls, Zooms throughout the day. But then I also like to hear feedback as far as like what people think in regards to, in this case, the budget announcement. Making sure that we're hitting the markers in terms of what we're getting from our community leaders, but then also too as well, like I mentioned at the end of my comments, there is more to come. Like with the budget being done, there's an opportunity that we have in Lansing right now where there's still billions of federal dollars from the American Rescue Plan that we need to spend, that we would like to see come down the locals inside of our community. And so, yes, please utilize my contact information on the screen, whether by phone, text, email. That's how I receive, that's how I get feedback primarily, and then bring it right back into the administration.
Thank you, Gary. So many times we ask our community members and we give these emails out, but we want them to really understand that their voice does count. So when you're asked to give a call, if you see something or you got some insight, please feel free. Gary actually does take this information back and helps to make sure our voices are heard at the state level. So Gary, we want to appreciate you for that and say thank you very much and keep doing the work that you're doing.
Thank you, appreciate it.
All right. So we talk a lot about in this last year, we talked a lot about this COVID virus, going from knowing nothing to learning a little bit and then learning more, going from no testing to testing and now vaccines. I want to invite Dr. Deborah Verholden and Dr. Pamela Hacker to come forward at our roundtable right now so we can have a little bit of chat about what's going on. I received some very interesting conversations over the last few days, Dr. Deborah, and people are saying, and Dr. Hacker, and either one of you can just chime in here, but the whole issue with still helping us understand about quarantine and isolation. And Dr. Deborah, you keyed in on that a little bit, but we wanted to tease that out a little bit more today. So can you talk to us a little bit more about this isolation and quarantine?
Well, they're sort of both basically the same thing. Quarantine is what you do when you have a suspected or a known exposure. Isolation is when you totally remove yourself from others because you are a known COVID case. So, to a fly on the wall, they very much look like the same thing. It's getting yourself, getting others out of harm's way by getting yourself, out of the mix. But so it's sort of somewhat of a trivial distinction between quarantine and isolation, but one is what you do when you have a suspected or a known exposure, and the other is what you do when you know that you are an active COVID case.
So I do struggle a bit with, remember dyslexia. So the way I remember it is isolation starts with I, which is for ill people, and then quarantine doesn't start with I, so it's when you are. So that helps as well. But I think it's really important to remember that this distinction was really only made commonly with the pandemic. People really weren't talking about isolation versus quarantine much before the last 2 years. And it was like, I think quarantine was usually used for either one, even though it's always been that distinction. But since we've lost a lot of our communicable disease with the vaccines we've had already, and then the other health measures we've put in over the last 100 years, we really hadn't been using the terms quite so specifically. But now, like, it's general public knowledge now to use it.
And so there is some conversation about the number of days. Now we know that sometimes when people are exposed, we're asked to isolate or quarantine or stay away for a certain number of days. Some say 7, some say 10. We've heard 14. And just as a reminder for us, or clarify for us, where are we now with these decisions about how long?
So I'll try to take that one. That has been changing with ongoing higher vaccination numbers, because the risks are less than that your symptoms or things would be actually COVID, less than it used to be. And then also they have done more studies and been able to identify the days most likely to cause transmission of your illness. And for SARS-CoV-2, it's kind of unusual because you're most transmissible like the day two or 3 days before, and then the first day of symptoms if you're going to be symptomatic. But they also know that many cases are asymptomatic without any symptoms, and then you don't really know unless you're doing testing. And so that's why they are changing those dates. First, it was 2 weeks based on what the SARS-1 back in 2003 was for infectiousness to others, and then they narrowed it down. And now we have like much more rapid available testing as well. And so they are trying to let people continue their lives. And that's why they're starting to offer these other options for safe test out. And it doesn't necessarily pick up all the cases that may be out there, but it picks up, like 90, probably about 97% of them. And then with the combination of picking up cases early with the testing, combined with more people are being vaccinated, that's why it's safer now to go down to 10 days. So 10 days is now the standard. And there are certain professions or schools are allowed to do certain tests out as well. And those vary depending on what the school resources are. If they can do a daily antigen test and cover those children days 1 through 7, to make sure that at the time that they are most likely to be spreading it, they are not contagious, we then can keep kids in school. They should still not be doing all their normal after school activities though, and that's a really important point. Because after school activities, as we all know, many are outside. We do not necessarily ask them to mask, even though they should and absolutely must if they are officially in quarantine, even if they're doing the test out. But it just, we do ask them to limit their activities, and if they go anywhere, which they should not do if they don't have to, absolutely wear a mask, a nice fitted mask, because they are providing source control for not spreading it to others.
So that's the quarantine issue. I remember once before, Dr. Deborah, you and I were in a conversation here, I think, and you correct me if I'm wrong on this, but you said you cannot test out of isolation, test out of quarantine, but not out of isolation. Is that correct?
Okay, so remember, we're dealing here with a lot of moving targets. These recommendations have also changed.
Okay.
Right?
Mm-hmm.
And I know we all remember the day we woke up and the CDC said, oh, if you're vaccinated, you don't have to wear a mask. And we all went, wait, what? Like, it just sort of changed. So that was the protocol back then, that people could not test out of, they couldn't test out of quarantine. They had to quarantine for whatever the set number of days is. But again, as we learn more about the disease and as we learn more about how to, mitigate transmission, those recommendations are evolving and changing.
Mm-hmm. And I asked that because I think you make a very important point. Things are changing. And so we want to be mindful to listen carefully. That's why we're asking those of you that we trust and understand, because we hear a lot on the media all the time and it's changing. So we want to be sure we can trust what we're hearing.
Yeah. Yep. Yep.
But yes,
Well,
so you cannot test out of isolation. So if you're diagnosed with it, you do have to stay home
yeah.
the appropriate amount of time.
So when we talk about now, we talk about having been vaccinated, and many people have gotten that first and second dose. And recently, when we've had conversations on this webinar about the booster shot. So I want to just talk about that a little bit again today too. The booster, FDA is looked at approving the booster. And is it a booster or is it just a third dose?
Such a great question. They have made the mistake, I think, of trying to first say booster and then pull back a little bit by calling some of the people getting it a third dose. It is right now, it is the exact same shot of Pfizer. Moderna is going to be coming out with a booster or third dose, booster really for Pfizer, that they're saying is going to be a lower amount, like just half the dose. But let's go with what we have available right now. What we have available is approval for Pfizer. That is still changing day to day and organization to organization. And you think, well, why don't they really know? And they do really know. They know that it is effective to boost it. They know how much it's going to boost it. It's probably after about 8 months, the Pfizer, 6 to 8 months, the Pfizer vaccine's gone down to about 88% effective. And everyone really loved that 95% effectiveness. And we would like everyone to be able to keep it at that level. But again, they are trying to make a distinction between who really needs it right now and who should we kind of hold back because it's still very effective. And if you are going to get infected with it and you've been vaccinated, you'll have a milder case. And so right now, I think 2 days ago, the CDC, no, 2 or 3 days ago, ACIP came out and said, here's the guidelines for who should get a booster shot. Then the CDC came out, was it yesterday? I hardly know, and said, here's a little bit different. And then now the director or FDA did. See, even I can't keep them all straight, but the FDA had approved it for a different use. And then the CDC's director just came out today, including healthcare workers. So healthcare workers were first in, then they're out, now they're in. So it's not actually been approved through what channels we use, which is the Michigan Department of Health and Human Services will approve what we are recommended to do in Michigan, because it's going to be based on age, from what age cutoff we should be using. It's going to be based on your immune status. So people who are taking certain drugs for like rheumatoid arthritis or psoriasis, they are more vulnerable. People who are living with HIV, they would be more vulnerable. And those people would be getting what is known as a third shot. Also, it's the same though as a booster. So the age is going to be related more. If you're a healthy 65-year-old, you will be recommended a booster shot. But if you are someone who has immunocompromised, it's going to be called a third shot, and you can get it now from here. So it's a little crazy with these terminologies, and some of that is how they made the announcements, a month or two ago at the national level. Everyone can get a booster, and then it's like, well, everyone really can't, because we can't do it all at the same time.
So again, that's why this conversation is so important. And just to clarify, because someone is asking, and I think you said it, but if you can say it again, for right now, for those who are immune compromised and seniors, it is recommended that they can get the third shot, the third vaccine.
If you're immunocompromised, right now you could get the third shot, because we know that they're not building their immune system the way we want it. doesn't matter kind of what age you are. If you're someone who is truly immunocompromised, like if you've had a solid, like a kidney transplant, you are immunocompromised so that your body doesn't reject it. They deliberately keep your immune system down. So you need that third shot, and you need it now. You have only to wait 20 days in between your second shot and your third shot. Booster doses are for protecting people against that decrease in immunity that comes with time. Just like we get a tetanus shot every 10 years. It's a better example actually than the flu shot, because the flu changes. Tetanus doesn't really change, but the vaccine effectiveness goes down with time. So after 10 years, they recommend getting another tetanus shot for everyone. And so the booster shot would be more like the tetanus shot, where you want to watch where is it going to be that we recommend you get that next booster to boost your immune system back up to the levels it was before.
And that's still in
Yes.
discussion.
So we're not giving that out yet. I suspect that some groups, age and probably healthcare workers, but that's up in the air, would be getting that next approval next week, but I don't really know, maybe the week after.
So we've got some additional questions coming in on this, and I think they're important for us to respond to if we can. So one question is, where are people who are immune compromised supposed to go to get that third dose, and what proof do they need to show that in order for them to obtain it?
So for vaccine clinics held by the county, if you go and you say that my doctor has told me that I'm immune compromised, ideally you would volunteer that it's because I have a transplant but you don't have to. We are not actually asking anyone to prove that their immune status. So if you go to a health department clinic right now, you would get it. If you just ask for a booster shot, you would be requested not to, and you would be requested to wait because we aren't authorized. And the other situations, like if you want to go to a drugstore or something, I am only hearing anecdotal things. I'm hearing some people say, oh, I went to a certain drugstore and they didn't ask me a thing. I just said I'm here for my booster, and they gave it to them. I personally have a family member who went to that same chain of drugstores, and she is over 65, and they said, no, we're not giving it to you yet, but the county she lives in, the county health department was giving it. So it is just something that you keep doing all the things we are already saying to do. That's not going to go away for a little while longer, but probably within the next week, all these uncertainties about that will be cleared up, because it just has to go through the state.
Right. So would you recommend, Dr. Hacker, that people do maintain relationship with their primary care physician in these cases, just to be sure?
Oh, always. I mean, that is so important. And if your doctor, like just say you're significantly older than 65, if you are one of our, really valued, like over 80 kind of person, your doctor is probably going to say, go get that, you're immunosuppressed or you're immunocompromised. This is a function of aging. If your doctor tells you to go get the shot and you come to a health department thing and say, I've been told by my doctor I'm immunosuppressed, we are not supposed to argue. And if they argue, you could tell them you just saw Dr. Hacker talking on the panel. And then I'll get the call.
Okay, just one last question, because you mentioned flu, and flu season is coming up. So question, can people get the flu vaccination and the COVID vaccination at the same time?
They can. They absolutely can get it at the same time. They have approved it. Now is the time to start getting the flu vaccine. They just came out this year and said they don't recommend, unless you're pregnant, trying to protect the baby, which it does do, which is great. Try not to get it unless you have a specific reason in July or August when it first comes out, but do get it starting in September. And so this is just about the perfect time to get your flu shot.
Okay. There's one last question, and I'm gonna come back to you, Dr. Deborah, because I think you have a good model about these guidelines that you can share with us today before we go to our next segment. And that is, someone just got word that their granddaughter's stepbrother got reinfected for the second time, very young. And so Dr. Hackerson, what do you recommend they do? What options do they have?
And they've had the 2 shots?
They're very young, so they haven't had the vaccine.
Oh, it depends on, I mean, the Pfizer is now approved for the 5 to 11. It has, again, it has to go through those channels, but it should be coming out towards the end of October. So I would really recommend that. But you know, I think we have to go back to the basics of health prevention. You know, wear your mask, wash your hands. You know, particularly if you've been anywhere outside the home, wash your hands. Try and encourage them not to touch their face, which I struggle with, so it's not that easy. Love to touch my face. So, so those are the things we really have to go back to. And then if they're getting in again, like start to look and say, are they going to gatherings where people are not wearing masks? Because you don't catch it you know, spontaneously. You have to be exposed.
Okay. Thank you. And I see you nodding, Dr. Deborah. What say ye?
My daughter once came to me and she said, Mom, I need to be allergy tested. Every time I eat pineapples, my mouth itches real bad. I said, you don't need to be allergy tested. Just stop eating pineapples. Like, this is, you know, when you hear about these cases, and William said that the ages are 6 and 7, and they're both unvaccinated. This is an issue of prevention. You know, for somebody to be reinfected at that age, you know, there's got to be some lapses in the preventive efforts, and so that's what I really encourage people. Just like Dr. Hackert said, go back to the basics. And for the kids, I mean, I think it's especially important because they don't have the option to get vaccinated. And that myth that we had that somehow kids were immune to it or it wasn't that going to be that bad, you know, now that we've got all these pediatric cases and deaths and peds cases that look like they might be these long haul COVID cases, you know, we know better. So now we really just have to do better. And again, it's just the prevention, that good health prevention, the hand hygiene, the masking, and a 6 and a 7-year-old, there's no reason why they should not be masked. You know, that watching the distance and the density, it's important, and it's important for everybody, adults and for children.
Thank you so much. And again, I want to just say that we talked about that isolation and quarantine. We're talking about now, there was a little a model you had for us, Dr. Deborah. That's a slide that I do want to show and have you just go quickly over that. But I also want to say this leads us really into our next segment. So please stay tuned. If you just joined us, we've got some good information for you. Dr. Deborah, can we go to that next slide, please?
Sure. Is one of our slide people going to pull that up?
I'm trying to give us a clue to get to the next slide. And then while we're waiting for that, I want to ask you, we've got good questions coming in the queue. We have great presenters and panelists in the background ready to answer these questions for you. Thank you for all this wonderful input from you as our participants today. So please continue putting those questions into the queue. There you go, Dr. Deb.
Yep. So this is the basics. I like what Dr. Hacker said. I'm going to take that. Isolation, I, is for people with the illness. Quarantine is to keep people who was in close contact with somebody who was COVID positive away from others. And the recommendation is to stay home for 14 days after your last contact, and obviously to monitor your symptoms. For people who are known COVID cases, they've tested positive. And this is regardless, it says, wait, who is sick or tested positive? Oh, without symptoms. Yeah, so regardless of if you have symptoms or not, you should stay home at least 10 days since the symptoms first appeared, and you have to go 24 hours with no fever. And that's in the absence of taking fever reducing medication. And most people should test. You should test, and you should have a negative test before you are cleared to go. And so, yeah, these are just good old recommendations right from the CDC. Folks can go right on the CDC website and download these materials themselves. And I do think this is the kind of stuff that people need to be talking about with their families.
Yeah.
You know, you should be talking about these things so everybody is sort of elevating their, knowledge and understanding.
Thank you, Dr. Deborah. Appreciate you and Dr. Hacker for sharing that information. These are questions that have come up from community members and some of our panelists, some of our participants. So we just want to make sure that we're being responsive to you. One of the questions that came up last week, and it was kind of part of this conversation, I think, with this question about 5 to 6 year olds and those children going back to school. And it was mentioned to us by Tricia Hill from GISD that every school district makes their own decisions. And some school districts are requiring children who have been exposed that they should quarantine. And if they want to go to school, they have to get tested every day for that 17-day period of quarantine. So we reached out to Health Alliance Plan to give us some insights about how insurance coverages is working in dealing with all of these issues. So we want to appreciate Dr. Yvonne Sessi, who's the medical director of the Health Alliance Plan, for joining us. First time here. Welcome, Dr. Sessi.
Thank you very much. Thank you very much, Ms. Lewis, for having me. I really appreciate the opportunity to speak to you. And I just want to reiterate what Dr. Hackert said and what Dr. Deborah said about prevention. I think that's our #1 goal, is to try and prevent people from getting this disease. So wearing your mask, getting the vaccination, and just good hygiene is really, really important. Now, when it comes to actually testing people for COVID, if you have symptoms of COVID, and they sometimes can be confused with an upper respiratory infection or with allergies, because you can get a runny nose, some nausea, vomiting, diarrhea, shortness of breath, the loss of taste or smell. Definitely get tested in that situation. And that's something that the insurance companies will cover, because we are looking at diagnostic coverage of testing. If you are asymptomatic but have been exposed to someone with COVID, that is another situation where that would also be covered. And it's very possible that you have the vaccine, you are exposed to someone with COVID, you can get tested then to make sure that you don't have a breakthrough incident of COVID. So those are the situations where coverage, insurance coverage, would be effective. Now, if you have testing, like in schools, for example, I know the University of Michigan, if you're not vaccinated, you need to be tested every day, whether you have symptoms or not. So in a situation like that, that would not be diagnostic testing. It's just routine testing for purposes of their own policies. So that would not be covered typically by insurance companies.
Thank you. And so this is really important because we do have free testing sites, and we'll talk about that in our next segment, free testing sites. So we want to encourage people to use the community testing sites that are at no cost, and we'll give you some more details on that. But just to be mindful, because this is a really important thing for families to understand. So they'll have to make sure that they document that. If they have a diagnostic, and that means if they've been tested or if they've been exposed and they want to get tested, that is covered by health coverage. So, Doctor, I wanted you also to talk to us a little about HAP has 3 different types of coverages, right? You do the commercial, you do Medicaid and Medicare. Can you talk to us a little bit about those distinctions?
Yeah, so there are different types of health policies, health plan policies. So we have commercial policy, which is typically, a younger group under the age of 65. 65 is roughly the age where you're eligible for Medicare coverage. So you have Medicare Advantage. That's one type of Medicare type of insurance that insurance companies carry. Commercial is usually anything, under the age of 65. So, I have commercial health insurance. My husband has Medicare insurance, for example. And then you also have Medicaid insurance as well. So those are the three basic ones. There's also a combination of Medicaid and Medicare insurance as well for those who are elderly and don't have the finances. But when it comes to the COVID testing per se, we treat everyone the same in that regard, that if you are symptomatic, you should get tested and it will be covered. If you are asymptomatic but have exposure to COVID, again, that would be covered. In other instances, it might really depend on the situation, but typically those would not be covered.
So it's really important that when people, whatever health coverage you have, and they've heard us talk about this, whatever health coverage you have, we have this phrase now working with the Genesee Health Plan that says, get it, keep it, know it, use it. So if you, whatever health coverage you have, please get it, please know it, and know how to get the best use out of it. So sometimes people have coverage and they don't even know what that coverage asks for. So if they want to get more information, Doctor, how do they get more information about HAP? Maybe they're interested in some of the coverages. Okay, what would you recommend?
I would recommend calling our customer service area first off, because they can be very helpful. And when you're talking to them, make sure you get their name and the date and the time that you talk to them. Because if you ask them, well, do I have this covered or not covered? It's important to know who you spoke to when you got that information. Because sometimes you run into problems later on, you get a bill and you say, well, I talked to somebody and they told me it was covered, now it's not covered. So it's important for documentation that you have that information. And that becomes really relevant because if you do get a bill, for example, for COVID testing, you can write to the company. So they'll give you specific, what's the address. But when you write something out, you should be very specific as to, when you had the testing, who were you exposed to, how were you exposed, also including, the date when that happened, what the situation was, perhaps how close you were to that individual, anything that will help support the reason for going and getting tested. And then, I would make a copy of anything that you write to the insurance company for documentation purposes, because, it can happen that it's lost in the mail system, so that you have a copy of the letter that you wrote, as well as the invoice or whatever bill you got from the urgent care or wherever you had the testing done. If everything goes pretty smoothly, you might expect perhaps between 6 to 8 weeks getting reimbursed if you had to pay up front for the testing.
Thank you. And I was going to ask you about the billing, so I appreciate you sharing it. Because when you have to go maybe on a Sunday night and you can't go to one of these free sites, you may have to pay that cost. But to know that it could potentially be covered for you, but the importance is getting it documented appropriately. So I'm going to ask you if you could just review that for us one more time. What do people need to do if they find themselves needing to be reimbursed?
Okay, call customer service at the health plan that you're affiliated with. They can give you specific instructions as to the address where you need to send the information. You need to write a letter and be specific in your letter as well. Don't think that the urgent care or whatever or the doctor's office is going to write a letter for you. Now you can ask them to write a letter for you, but I really believe that if the member writes the letter and is sincere and puts in all the facts of what happened, when they were exposed, who they were exposed to, did they have any symptoms, what were the symptoms, how long they lasted, and the situation. Put that all in the letter. That's very important. We do read these letters, and then it goes to the claims department and they adjudicate it there. Sometimes it comes to the medical director. Not that often, but when it does, we do look at those things. And if you don't get any answer, the other option is, and all insurance companies have this, is a member grievance and appeal. So you can specifically write to the to the health plan and calling it a member grievance and appeal. And then there's specific rules and regulations that must be adhered to, particularly for Medicare and Medicaid, and commercial as well, but mainly Medicare and Medicaid, that the insurance plan needs to follow. And those definitely will all be addressed. And those can include reimbursement issues as well. Typically just going through the claims process, that should work. That's why I say it's important to keep a copy of everything you do and who you spoke to, because you never know, it might, resurface a couple months later and to say, oh, I did talk to somebody at the health plan, I can't remember the name. It just adds credence to your case, and that really, really is important. And I think that's probably true in any issue that you're dealing with, is really to have all the facts with you and be prepared and be thorough in your documentation.
Thank you so much. And in our earlier conversation, we also recognize that you have a JD, so you're giving us the law.
Yeah, I'm giving I'm giving you more of that legal part, like have everything documented. Yeah, cross your T's, dot your I's, that kind of thing. Yes.
Well, that's so important, because sometimes without that information, when we're in a difficult spot, we don't get the responses that we need. So we all have to learn how to be our best advocates and help others as well. So again, we want to encourage those of you that are listening, that you jot down these notes. Please help us to help our other communities understand these very, very important elements that are being discussed here today, because all the health plans pretty much have these same criteria. So whatever your health coverage is, please be sure you follow these guidelines. Thank you so much, Doctor. We appreciate you sharing with us today.
Thank you very much.
So we've talked about this, and I appreciate you, Dr. Stacey, for talking about the grievances and appeal. And one of the things that we want to be sure about is that we know where to go to even get started with the process of testing and understanding. So I want to bring on Sherelle Brown from the Genesee County Health Department to tell us what the health department is doing as the advocate for the public health for Genesee County.
Good afternoon, everyone. So first and foremost, I would like to say that we are still hosting our COVID-19 vaccination clinics and still educating on COVID-19 prevention throughout the county between ourselves and different pharmacy retailers. Over 345,000 doses of COVID-19 vaccines have been administered. Right now, 45.3% of 12 years and older residents in Genesee County have been fully vaccinated. And over 50% of the population has at least received at least one dose of the COVID-19 vaccine. So we are still making strides to get everyone vaccinated who has not been vaccinated. And we need you to come out to these clinics and get your vaccine. Next slide. Also, we need you to get tested. We have seen cases go down in the last week. We saw 438 cases reported in the last week, which is a decrease, but we've also seen a decrease in testing. Our positivity rate is right now at an 8.8%, but we're seeing less testing. So we need you guys to be cognizant of the testing that is out there, the locations that are free. In Genesee County, we have Word of Life Church, Bethel United Methodist Church, as well as Macedonia Baptist Church, that all offer free COVID-19 testing. And you can also visit one of the local Rite Aid or Walgreens on our website at gchd.us. We have a listing of the actual addresses of the Rite Aids and Walgreens that offer the free testing throughout the county. And then Hamilton Community Health Network is still a place that you can go to get free COVID-19 testing. Some of those sites also offer the vaccine as well. But if you are having a hard time getting a vaccine, the Genesee County Health Department does offer always on Tuesday, Wednesday, and Thursdays. Next slide, please. You can find us on Tuesdays at Our Lady of Guadalupe Church from 12 to 2 p.m. We do Pfizer and Moderna there, and Wednesdays at Central Church of the Nazarene from 10 to 12. We have all three vaccines, Pfizer, Moderna, and Johnson & Johnson. And for those who can't make it early in the day clinic, we do offer a clinic from 3 to 6 p.m. on Thursdays at Shiloh Missionary Baptist Church. So make sure you come out and get your vaccines, get our 12 and older into a clinic and get their vaccine. And if you are immunocompromised, come out and get your third shot. Lastly, I would just like to touch on the fact that the health department is still offering home-based services to those who are homebound. So if you know anyone who cannot walk into one of the clinics mentioned, please have them call us at 810-344-4800 or visit us at gchd.us to get on our list for at-home vaccination.
Thank you so much, Sherelle. And I just want to remind everybody, Dr. Reynolds speaks so often to us about that cadence testing. That means testing on a regular basis. And it's a delight to know that these 3 sites are open every week and 6 days out of the 7. So if you want to make sure you get a plan, put a plan in place that you can get your testing done. That'll help us in a tremendous way. So thank you, Sherelle, for that. We're going to hear now from Dr. Deborah Holden. When we talk about the cadence testing, it helps us to understand our positivity rates and where we are. And so Dr. Deborah Holden with the Flint Center for Health Equity Solutions and Associate Dean of Public Health Integration and CS Endowed Professor of Public Health and all of those wonderful things. Dr. Deborah, where are we with the policy brief and the updates?
Okay, great. So we give you just the data first, and case counts just went down a little bit in Genesee County, and I'll show you on the next slide what that looks like, by 19 cases. So it's a small difference, but they did go down a bit. They went up again and continue to go up for the 12th consecutive week in Flint. We'll have, again, a better picture of what the case counts actually look like probably in another week or so when we get all of the case counts in. So take that sort of with a grain of salt, that slight decrease that we saw in Genesee County. And the testing positivity rate in the county also went down slightly. And again, what that is of the people who are getting tested, what percentage of them are coming back positive. So last week it was 10.9%. Right now, this week it was 8.8%. We still have this ongoing issue with the lag cases, and you'll see those are the ones in gray. Those are the cases that come in more than a week after the week closes out. And you see that keeps happening. Last week in Flint, we added another 11 cases to the count that we already had. And now we've got this new measure of probable cases. And again, the only way to get counted as a COVID case is through a COVID test. Even if you were in a household, you were exposed, you had all the symptoms. If you don't get tested, you don't really show up anywhere. So counting these probable cases, sorry about the ringing, but counting the probable cases gives us a better sense of what infection might actually be in the community. Next slide. Sorry, there's nothing I can do about that either. Sorry. So you all heard on Wednesday, the 22nd, the FDA approved an emergency use authorization of the Pfizer vaccine for a 3rd dose or a booster dose to be administered. That's at least 6 months after completion of your vaccine series. And I like saying series because for some people, their series was a 1-shot, and for other people, it was a 2-shot. For some people, it was 21 days apart. For some, it was 28 days apart. Regardless, when you got your end of your series, if it's been at least 6 months, you are now approved for a 3rd shot in individuals who are 65 and older, or if you're 18 to 64 and you are at high risk for severe COVID or bad outcome, right? So if you're immunocompromised, some underlying health conditions, etc. And the second category is if you have frequent institutional or occupational exposure. So these are our frontline workers, our healthcare workers, our essential workers. So anybody 65 and older, or people who are 18 to 64 at high risk for severe COVID or frequent occupational or institutional exposure. And we will keep people updated. And a reminder, that is only for the Pfizer vaccine and for people who got the Pfizer vaccine right now. This is one of those things we're going to have to stay with it because things are evolving, but that's where we are for right now. Next slide. So the recommendations for policymakers, we saw the White House jumped out, said everybody should get boosters. You know, that's not following the science. You can't follow from the front, right? So following the science means following the science. Let the science lead the way. People have asked this question all the time. They're like, who do I listen to? Who do I, and I want to be really clear. The FDA is the authority for which medications can be used and for which purposes and by whom. They are the authority on that. The CDC is the agency that will give recommendations and guidance on the how, right? Like how these things get rolled out. So we just need to follow the science, because my concern is that in the absence of following the science, people are getting confused. And the confusion to me is not our fault. It's not the people's fault. It's the mixed messaging, the inconsistent messaging, and non-scientists, non-professionals jumping out in front of the science and saying things that are either politically motivated or make people feel good or whatever, or are popular, but that are not rooted in science. So we really are counting on our policymakers to follow the science. The second thing is to advance equity and approve the state budget. It is moving through the process. It is on its way to the governor. There's so many great things in this new budget that are going to, I think, be a real victory for equity. Lots of expansions around, and Gary shared some of this around some of the many resources for children and for families, low wage earners, health navigators, just all kinds of great victories. So we really just want to applaud the work that they did in the State House to come up with this bipartisan budget and move it forward. So bravo, but let's get it done, pen to paper, and get these resources fairly and equitably out into community. That's my spiel for today.
Deborah,
You're on mute.
I was pushing my button and it wouldn't work.
Yeah.
But thank you, Dr. Deborah, for those insights. And I was taking a note when you were talking earlier, and I just want to thank you for following the science. When I listen to you and Dr. Hackett, and I haven't listened to Dr. Reynolds over time, you help us every week. We're bringing information multiple times in multiple ways because we all learn differently. But we appreciate you helping us to listen at these numbers, you're explaining the numbers, and also helping us understand the science, because that's not a researcher in that way. It's difficult to really sometimes understand those terms. So thank you and for bringing that information for us.
There is one quick question here in the chat too. Somebody asked about thoughts on whether or not the vaccine will be needed or required as an annual booster for COVID, and likely in what time frame. Dr. Hackett had to take a clinic call, so she's not on. It would be a great question for her. Nobody can actually say with certainty, but here's what we can imagine, right? Is that, the same way the flu is, there's flu season and there's a flu shot, and it's an annual flu shot. Why? Because the strains for flu change and, mutate and things like that. COVID will likely not be an exception. Just look in the past 18 months at how many different variants we have of the virus that causes COVID-19. So what is predictable is this will not be a one and done type deal. It will predictably be something that will be a regular, whether it be annual or even more frequent vaccine. But again, that's what's likely. We're learning in real time and we'll know more, but people should be prepared for that. And I would not also be surprised if we don't start to see COVID vaccines maybe as cocktails also, right? Like it might go along with the flu. You might, just like you get a measles, mumps, rubella, MMR, and you get a Tdap, which is the tetanus, diphtheria, and pertussis. It is also possible that it could end up being a cocktail. So you'll get multiple things in one dose.
Thank you, Dr. Dever. So all I can say right now is stay tuned. We're in an
Yeah.
ever-learning environment, and we want to do our best to carry the information well. Kiana from our mayor's office, we don't want to forget hearing something important from the mayor's office. So please, as a public health manager for the city of Flint, bring us an update today. I think you're on mute, Kiana. Okay, try it again. We can't hear you.
She's not on mute, but she has
It's
no
not on mute, but
volume.
we can't hear you. Can you turn your volume up, maybe? Oh,
Nope.
no, because we heard you earlier. I'm not sure what's happening. Okay. Kiana, while you're working on that, I'm just going to ask for those of you that are listening and for those of you that are community health workers and social workers, every week we share this information with you and we ask you to apply for your contact hours. We have so many of you that are applying. We want to make sure that when you select either one, put all of your information in, particularly make sure we get your email address so that our team can follow up with you to be sure that you get your continuing education units. We don't want anybody to miss out. I will have to say to the Flint community, I'm actually at a conference right now, and we're hearing a lot about the example that Flint has contributed. And one of the things is really important is how our community, even in the midst of challenges, we find a way to rally together. And I see so many opportunities like this one, where community members said, we want to get community health worker credits for being able to participate in this webinar. And then you set some things in motion in order for that to happen. Social workers gave us a call and said, is it possible to get social work credits? As a result of that, we're now offering these credits. So we want to be sure that you can utilize them. And so please be sure today to put that information in and we'll get you the information you need to get these contact hours and the continuing education units. Kiana, you ready now?
I think so. I switched over to my phone. Am I okay?
We got you. Yes, you are. Yay.
I will say again, good afternoon, everybody, and happy fall to you. I know so many of us love fall so much. I'm not a pumpkin spice person, but shout out to all the pumpkin spice people. Have your time. I just have a few updates here from the city of Flint, beginning with, there was an announcement earlier this week from the City of Flint Treasury Department, and I wanted to make sure that the information was communicated that water shutoffs are beginning for commercial properties. So it's important to make that distinction for our residents. That does not pertain to residents. It is strictly for commercial properties. There are some details associated with those water shutoff for commercial properties listed on the City of Flint's website. So anyone who is curious about those details can go to the website and find out that information. Last weekend was downtown Flint was all energy all weekend. And I just wanted to take this opportunity to say thank you to everyone who made the Gus Macker possible, every community organization, every partner, every resident that came downtown this past weekend to enjoy the Gus Macker's return to the city of Flint. Thank you so much for participating and making it such a glorious weekend for our city. The City of Flint's social media pages are continuing to highlight local businesses. So you can go to the Facebook page and check out profiles for small businesses here in Flint. I think I've learned a whole lot about organizations that I didn't know were here through those posts. So I encourage residents to check those out as well. Coming up, beginning this Sunday, and continuing for 6 Sundays in a row, there will be family fun time downtown Flint. And this is happening near the Flat Lot from 3 to 6. There are going to be food trucks. There's going to be a vendor and family activities. So we want to encourage everyone to come downtown on Sundays through, I think it ends Halloween, to enjoy family time together, and again, to support small businesses with those food trucks. And then finally, just a reminder that the mayor still has the radio program happening on Saturday mornings at 9 a.m. There is also a Facebook broadcast for that meeting, and it is a great primary source of information if residents would like to hear what is going on with the city from the mayor.
Thank you so much, Kiana. And we want to thank you. We're at our time today. We want to thank you for joining us for this 80th session of the Flint Community Webinar Coronavirus. Please like us on Facebook, subscribe to our YouTube channel, Healthy Flint. Give us an email or call us. Our email is info@hfrcc.org, or call us at 810-835-2130. And we'll see you next week for week 81. And we've got a great session for you coming up. Thank you again for joining us, and we look forward to continuing to share with you. See you next week.